Have you ever noticed how certain things we took for granted when we were younger seem to change as the years go by? We adapt, we find new routines, new ways of enjoying life. But sometimes, there are aspects of our well-being that are less talked about, things we might not even consider until we feel their absence. There's a quiet truth that doctors and researchers are starting to highlight more and more, something that has a profound impact on our health and happiness as we age. Yet it's often swept under the rug because it feels too personal, too private. The reality is, neglecting this one area of our lives, something that involves intimacy and connection, can lead to surprising and sometimes challenging health consequences you might not expect. It's a secret that affects not just our physical bodies, but our minds and our emotional state too. In this video, we're going to gently pull back the curtain on this topic. We'll look at what the science suggests happens when this kind of connection is missing in later life, and crucially, what you can do about it to protect your health and vitality. There are things you might experience that could be linked, and understanding why is the first step to feeling better and living more fully. Watch to the end for something that will surprise you about just how vital this often ignored part of life truly is for staying healthy and happy in your golden years. Let's talk about what happens inside your body, right down to the pipes and pathways that keep everything running smoothly, especially your heart. Think about what any kind of physical activity does for you. It gets the blood pumping, strengthens muscles, and improves overall circulation. Well, sexual activity is a form of physical activity, and doctors are seeing clear evidence that regular engagement can be like a mini workout for your cardiovascular system. It increases your heart rate, improves blood flow throughout your body, and can even help lower blood pressure over time. This isn't just about the immediate exertion, it's the cumulative effect. When this activity becomes less frequent or stops altogether, your body misses out on these regular boosts to its circulation. Over time, this can contribute to the natural stiffening of blood vessels that happens with age. While it's not the only factor in heart health, losing this particular form of activity means losing one more tool in your arsenal for keeping your heart and blood vessels supple and efficient. Doctors observe that individuals who maintain some level of regular sexual activity tend to have better cardiovascular outcomes compared to those who don't. It's not a miracle cure, of course, but it's a piece of the puzzle. Think of it like this. If you stop walking, your leg muscles will weaken. If you stop using certain pathways in your body in this intimate way, they lose some of their elasticity and efficiency. What can happen? You might find that simple physical exertion becomes a little harder. You might feel less energetic, and while difficult to isolate solely to this, your risk factors for certain heart conditions might subtly increase compared to someone maintaining this activity. Now, I know what you might be thinking. What if sexual activity isn't an option for me anymore for various reasons? That's a completely valid point. And the important thing here isn't to pressure anyone, but to understand the benefits that are gained and how you might find other ways to achieve similar positive impacts on your body's systems. The cardiovascular benefits, for example, can be partially offset by other forms of regular exercise like brisk walking, swimming, or cycling. The key is consistent, moderate activity that gets your heart rate up safely. But sexual activity has a unique combination of physical exertion and hormonal release. When you engage in this kind of intimacy, your body releases hormones like endorphins and oxytocin. Endorphins are natural mood boosters and pain relievers, which can help you feel better overall and manage those everyday aches and pains that seem to crop up more as we age. Oxytocin is often called the bonding hormone. It promotes feelings of closeness, trust, and relaxation. These hormonal effects have a direct impact on your physical health too. Oxytocin, for instance, has been linked to lower stress levels and even potentially lower blood pressure. When these regular releases of beneficial hormones decrease due to a lack of intimacy, your body loses some of its natural ability to manage stress, boost mood, and potentially regulate certain physiological functions. This isn't just speculation. Researchers measure these hormone levels and observe the physical responses. They see how these intimate moments act as a powerful stress reliever. Chronic stress is a major contributor to inflammation and various age-related diseases, including heart disease and cognitive decline. So, if you lose a significant stress-buffering activity like regular sexual intimacy, your body's overall stress load might increase, and you might find yourself feeling more anxious or irritable without quite knowing why. Furthermore, the physical act itself helps maintain flexibility and range of motion in joints and muscles that might not be used as much in daily activities. This can contribute to better mobility and reduced stiffness. Imagine a joint that's rarely moved versus one that gets regular, gentle stretching and use. The difference in flexibility and comfort over time can be significant. So, if this specific type of movement and flexibility exercise decreases, you might notice a subtle decline in your overall physical flexibility and ease of movement. It's one piece in the larger mosaic of maintaining physical function as we age, but it's a piece that offers a unique blend of cardiovascular, hormonal, and muscular benefits that are hard to replicate perfectly with other activities alone. Understanding these physical and hormonal effects is just the beginning of seeing the broader impact on your health and vitality. Moving beyond the purely physical, let's delve into something just as crucial, if not more so, for healthy aging: your brain and your emotional landscape. The connection between mind and body is incredibly powerful, and intimacy, including sexual activity, plays a significant role in this relationship. We touched briefly on hormones like endorphins and oxytocin, which are released during intimate moments. These aren't just feel-good chemicals. They have measurable effects on brain function and emotional well-being. Endorphins, in addition to reducing pain, can create a sense of euphoria and well-being. Oxytocin fosters feelings of connection and reduces stress. When you regularly experience these hormonal surges, your brain benefits. Studies have shown that regular sexual activity is associated with better cognitive function in older adults. It's thought that the combination of increased blood flow to the brain during arousal and orgasm, the stress reduction effect, and the positive emotional connection all contribute to keeping the brain sharp and potentially slowing cognitive decline. Think of it as giving your brain a regular boost. Improved circulation delivers more oxygen and nutrients, reduced stress protects brain cells from damage, and positive emotional states encourage neural connections. So what happens if these regular boosts are no longer part of your life? Doctors and psychologists observe that individuals who lack intimacy and sexual activity in later life can sometimes experience a subtle decline in cognitive function. They might not be facing severe dementia, but perhaps notice memory lapses becoming more frequent, or finding it harder to concentrate or learn new things. Again, this isn't the sole cause, but it's a factor that contributes to overall brain health. The absence of the stress-relieving and mood-boosting effects of intimacy can also lead to increased feelings of anxiety, irritability, and even depression. As we age, maintaining emotional well-being is paramount. Intimacy provides a unique form of emotional connection, validation, and comfort. The simple act of being close to someone, of sharing that vulnerable space, is incredibly powerful for reducing feelings of loneliness and isolation, which are major risk factors for both cognitive decline and depression in older adults. If this intimate connection is absent, you might find yourself feeling more disconnected, even if you have friends and family. There's a specific kind of closeness that intimacy provides that is hard to find elsewhere. Without that regular release of oxytocin and the associated feelings of bonding, you might feel a greater sense of emotional distance, which can subtly chip away at your overall happiness and resilience. This isn't about needing sex to be happy. It's about recognizing the profound impact that this particular form of human connection and physical expression has on our intricate systems, both mental and emotional. Doctors often see that older patients who maintain active social and intimate lives tend to be more resilient, happier, and have better overall health outcomes, including better cognitive health. The brain thrives on stimulation, connection, and positive experiences, and intimacy provides a potent combination of all three. Furthermore, the lack of intimacy can also impact sleep quality. Stress and anxiety are major disruptors of sleep, and as we discussed, intimacy is a powerful stress reliever. If you're experiencing increased stress or emotional unease due to a lack of connection, you might find yourself tossing and turning more, or waking up frequently. Poor sleep, in turn, has a cascade of negative effects on both physical and cognitive health, creating a vicious cycle. Doctors hear this frequently from patients: a general feeling of being off, less sharp, more stressed, and poorer sleep. And sometimes when exploring lifestyle factors, the absence of intimacy emerges as a significant contributing element. It's a complex web, but recognizing the threads connecting intimacy, stress, mood, sleep, and brain health is vital for understanding the full picture of healthy aging. It highlights why this isn't just about pleasure. It's fundamentally about maintaining key physiological and psychological processes that support overall vitality. The next step is understanding how all these pieces fit together and what you can do to nurture these vital aspects of your health. So, let's bring everything we've discussed together. We've seen how maintaining intimacy, specifically including sexual activity, can act as a mini workout for your cardiovascular system, boosting circulation and potentially supporting heart health. We've explored its role in releasing beneficial hormones like endorphins and oxytocin, which are powerful tools for managing stress, improving mood, and fostering feelings of connection. We've also looked at how these effects, combined with increased blood flow, are linked to better cognitive function and potentially slower cognitive decline. And we've touched on how the emotional benefits and stress reduction can lead to better sleep and overall emotional resilience. Doctors aren't just observing these things casually, they're seeing the patterns in their patients' health trajectories. They see how a lack of intimacy can contribute to a constellation of issues, from slightly higher blood pressure and reduced physical flexibility to increased anxiety, lower mood, and even subtle impacts on memory and focus. It's crucial to remember that life circumstances change. Partners may pass away, health issues can arise, and for some, sexual activity may genuinely not be possible or desired anymore. The message here is absolutely not about pressure or judgment. It's about understanding the benefits that this specific form of intimacy provides and recognizing that if it's absent, you need to be more proactive in finding other ways to support those areas of your health. If sexual activity is no longer possible, how can you still foster deep emotional connections that release oxytocin and reduce stress? By nurturing close friendships, engaging in meaningful social activities, spending quality time with family, even gentle touch like hugs can be incredibly beneficial. How can you replace the cardiovascular and flexibility benefits? Through regular exercise tailored to your ability, walking, stretching, gentle yoga, swimming. How can you keep your brain sharp and manage stress? Through mental stimulation like puzzles and learning new things, mindfulness practices, and ensuring you're getting enough good sleep. The surprising truth doctors are highlighting is that while sexual activity itself offers a unique blend of these benefits, the absence of these benefits, regardless of the reason, is what poses the health risk. It's the lack of regular cardiovascular boosts, the lack of consistent stress relief, the lack of strong emotional connection, the lack of natural mood elevation, and the potential resulting poor sleep and increased anxiety that doctors are warning about. It's not that stopping sex is a direct cause of specific diseases, but rather that the benefits derived from it help protect against the age-related decline that contributes to those diseases. So, if that protective factor is gone, you become more vulnerable in those areas. The takeaway isn't that you must have sex to be healthy in old age. It's that the physiological and psychological benefits associated with regular intimacy and sexual activity are incredibly valuable for healthy aging. If that isn't part of your life, you need to consciously build other strategies into your routine to replicate those benefits, focusing intently on cardiovascular exercise, stress management techniques, nurturing deep emotional connections outside of a romantic or sexual context, and prioritizing mental stimulation and sleep. Doctors want people to be aware that this isn't just about pleasure or partnership. It's a component of overall health that has measurable effects on your body and mind. Ignoring this aspect, whether by choice or circumstance, means you need to be more diligent in other areas to compensate for the lost benefits. Remember, small changes can make a big difference to your health and happiness. Understanding these connections empowers you to make informed choices about your lifestyle. If this topic resonated with you, or if you have experiences or thoughts you'd like to share, please feel free to leave a comment below. Your perspective could help others. And if you found this information helpful and want to learn more about how to live your healthiest, happiest life at any age, please give this video a thumbs up and subscribe to the channel. We're here to explore all aspects of well-being as we navigate these golden years together. Live your best life at every age.